Are there genetic tests for opioid addiction? If you have ever wondered about the role of genetics in opioid addiction, you are not alone. Many people are curious about how our DNA might influence our risk for substance use disorders. Let's break down the facts surrounding genetic tests for opioid addiction. Yes, genetic tests do exist that can help assess an individual's risk of developing opioid use disorder. One notable test, approved by the United States Food and Drug Administration, is called AvertD. This test analyzes specific genetic variants from a DNA sample, usually collected through a cheek swab. It identifies whether a person carries a combination of genetic markers linked to a higher risk of developing opioid use disorder. AvertD is primarily intended for use before a patient is prescribed oral opioid pain medications for acute pain, such as after surgery. Importantly, it is meant for individuals who have not previously used oral opioids. The results from this test are designed to be part of a broader clinical evaluation. They help inform decisions about pain management and opioid prescribing but should not be used as a standalone diagnostic tool. The genetic markers tested by AvertD often include variations in genes related to the brain's reward pathways. A key player in this area is the OPM1 gene, which encodes the mu-opioid receptor. This receptor is a critical target for opioid drugs and plays a significant role in addiction biology. Research indicates that certain variants of the OPM1 gene are associated with a greater likelihood of persistent opioid use and dependence. This connection links genetic predisposition to the risk of addiction. However, it is essential to remember that genetics is just one piece of the puzzle when it comes to opioid addiction. Environmental factors, psychological influences, and social contexts also play significant roles in a person's risk. Some studies have shown that genetic testing panels, especially those that include genes beyond OPM1, may not reliably predict opioid addiction risk. This could potentially mislead both patients and healthcare providers. Current genetic tests for opioid addiction risk have limitations. Research suggests that the genetic variants tested explain only a small fraction of the overall risk for opioid use disorder. Predictive models based solely on these variants perform only slightly better than chance. Therefore, these tests should be approached with caution and always used alongside comprehensive clinical assessments. In summary, while genetic tests for opioid addiction risk do exist and can provide helpful information, particularly regarding variants in the OPM1 gene, their predictive power is limited. They are mainly used to guide decisions about opioid prescribing for patients who have not previously used these medications. Integrating genetic information with other clinical and environmental factors is vital for effective substance abuse prevention and treatment planning.